4 months into my pregnancy, I started to notice that I wasn't hungry at all.
She started to get really, really bad headaches.
I couldn't open my eyes or get out of bed.
I would take her to the hospital, the ER, every week.
They would just attribute every symptom to pregnancy.
But I knew by looking at her that it was something more than that.
One day, I woke up and didn't have use of my leg.
The next morning, I thought I heard a sound. I thought I heard Mama. But when I went in, she was having a seizure.
The doctors actually told us that she may not make it, the baby may not make it.
They told us that Iman's heart was failing, and now the main issue was to deliver the baby.
They went on ahead and delivered the baby, and everything went okay with that. But she actually started to get worse. Her heart just continued to fail.
The doctors told us that overnight, Iman's heart had stopped beating.
She's sitting there and something's beating for her heart, so she's clinically dead, and they said that we should probably just say goodbye to her. I don't like to talk about this.
It was a hard day.
Dr. Burke came in and he said that there was one more thing that they could possibly do.
He mentioned this heart piece called the Impella.
He explained to us that it was a tiny little pump that would be inserted into her heart. It would pump the blood and would let her heart rest, so it would eventually start back beating. They put the Impella device into her heart, and a couple hours later, they said that her heart had started beating.
The Impella implant definitely saved my life. I'm here because of it. I feel totally blessed to be alive.
We have Iman and her family here with us, as well as cardiologist Dr. Ray Matthews, who is a leading expert in this technology that helped save Iman's life. Thank you all so much for being here. You look fabulous,
You look great.
by the way.
And look at that gorgeous baby. It's bigger than mommy almost. Wow.
Hey there.
That was absolutely worth it, huh, Mama?
It was, every moment of it.
How are you feeling now?
I'm feeling great. Every day it gets better for me.
And let's explain to everyone what happened to Iman's heart, because here's a perfectly healthy mother-to-be,
right,
whose heart goes into failure.
right. So Iman had a dental procedure, which can allow the bacteria that naturally reside in your mouth can actually enter the bloodstream because of bleeding during that procedure. And it turns out that your heart valves are structures that don't have their own blood supply. So the bacteria can actually attach to the heart valves and actually create this infection. Now that's more common if you already have some abnormality with your heart valves. So that's why it's really important that when you go to the dentist, you let them know if you have a problem with your heart valves so you can get antibiotics so this kind of thing doesn't happen.
Something as harmless as a dental procedure opens up the areas in your mouth that allow the bacteria in. So in her case, you were able to figure out that Iman's heart was suffering from endocarditis, which can lead to heart failure. Let's talk about how this device actually helped save Iman's life, because it is a really fascinating device.
It really is. It's a very small miniature pump that enters through the main blood vessel, the aorta, and is threaded over a small guide wire and into the main pumping chamber, the left ventricle. Once in the left ventricle, it sucks blood out of the main pumping chamber, up through a shaft and out into the main blood vessel, the aorta, through a rapidly rotating propeller. So it can provide nearly all the blood flow that the human heart could on its own. And in Iman's case, really took over until her heart could recover on its own.
Because what happens in pregnancy is, we try and decide delivery, or if the delivery happens early, so that, if they're having so many problems with their heart, so that they can get this procedure and things like this done. And this is absolutely phenomenal, because postpartum cardiac myopathy can be really, again, life-threatening. And so these type of things are life-saving.
Let's show everyone, Dr. Lisa. The heart is the size of your fist. Of course, if it's diseased, it can be even bigger than that. But this device is really small. Mm-hmm. And so the fact that that can pump blood throughout your body
So here we're
is
holding
truly
a
remarkable.
common pencil in one hand, and you can see that this device is actually smaller than the pencil and actually can pump all the blood flow that your heart can for a transient period of time, a few days till you
So
recover.
fascinating.
This saved her life. Really did.
Matthews, thank you for
Yeah.
explaining this new technology.